The Chairman of PTF and Secretary to the Government of the Federation, honorable ministers and members of PTF, gentlemen of the press, both those live here and our colleagues at various remote locations, you, our esteemed viewer and listener, we want to thank you and welcome you specially to today, 1st of February, 2021. And you know, this month is so special. It's the month of vaccine. Well, let's wait eagerly for more information on this. But let us now invite the chairman of PTF and the secretary to the government of the Federation to the podium.
Members of the Presidential Task Force, distinguished ladies and gentlemen of the press, let me start by truly apologizing to you. It's been a long day. We started out in the morning with some of you at the meeting with the Christian Association of Nigeria. Then we had to attend to the PTF meeting. And we had our plate so full to consider so many issues relating to our national response. So our apologies. However, I welcome you to the national briefing by the Presidential Task Force on COVID-19 for Monday, the 1st of February, 2021. On 30th January 2020, the World Health Organization declared the new coronavirus outbreak that it constituted a public health emergency of international concern, thus triggering the highest level of concern possible. 1 year down the line, the world has seen over 100 million infections and over 2 million deaths. As at the same time, the situation in Nigeria stood at 130,557 infections with 1,578 fatalities. I believe the Honorable Minister of Health and the DG Nigeria Center for Disease Control will elaborate on recent numbers and situations. Since the month of November 2020, the PTF has regularly advised Nigerians about the dangers of non-compliance with protocols put in place to guide our conduct under the eased lockdown phases. We also issued advisories to subnational entities to ensure strict enforcement of protocols, especially as they relate to wearing of masks in public places, large gathering, personal hygiene, reopening of schools, testing, etc. All these actions were necessary, even as we watch the rising daily number of cases directly attributable to activities of previous weeks. We have also listened to voices of reason that called for enforcement of the measures. After considering the virulent nature of the second wave of infections, the dangers associated with the new strain of virus, particularly B.1.1.7, and the urgent need to protect the health and well-being of Nigerians in the face of the widespread and rising numbers of COVID-19 cases in Nigeria, His Excellency Muhammad Buhari, President of the Federal Republic of Nigeria, signed the Coronavirus Disease COVID-19 Health Protection Regulations 2021 in exercise of the powers conferred upon him by Section 4 of the Quarantine Act, Cap Q2, Laws of the Federation of Nigeria 2010, and all other powers enabling him in that behalf. The new regulations, which has been given wide publicity, covers the following parts. Part 1, restrictions on gatherings. Part 2, operations of public places. Part 3, mandatory compliance with treatment protocols. Part 4, offenses and penalties. Part 5, enforcement and application. And Part 6, interpretation and citation. Essentially, the following restrictions have been restored and backed by this regulation. Social distancing of at least 2 meters shall be maintained at all times between persons. Gathering of more than 50 persons shall not hold in an enclosed space except for religious purposes, in which case the gathering shall not exceed 50% capacity of the space. Operations of public places such as markets, including open markets, malls, supermarkets, shops, restaurants, hotels, event centers, gardens, leisure parks, recreation centers, motor parks, fitness centers, etc., shall be guided by the observation of the following: wearing a face covering that covers the nose and the mouth. Facilities are provided for the washing of hands or application of hand sanitizer approved by NAFDAC, and facilities for checking body temperature are provided, and any person found to have a body temperature of about 18 degrees Celsius shall be denied entry and advised to immediately seek medical attention. The regulations also places some responsibilities on the operators and occupiers of premises for the enforcement of these laws. They are required to make provision for safe hygiene facilities, enforce provisions of temperature checks prior to entry into the establishment, enforce provisions and use of face covering within the establishment, ensure that their customers queue up and are attended to serially while complying with physical distancing measures and avoiding overcrowding, and generally ensure compliance with the provisions of these regulations. The Presidential Task Force strongly appeals to all subnational entities to please remain conscious of the rising numbers and the associated fatalities. They are therefore required to establish appropriate structures and systems for the enforcement of these regulations. The Presidential Task Force will continue to collaborate with the Nigeria Governors Forum on the management of this public health emergency, because every citizen resides within the jurisdiction of a state and the Federal Capital Territory. The Presidential Task Force also wishes to draw the attention of all Nigerians to the fact that sanctions and punishment, including jail terms and fines, have been prescribed for violators of the provisions under the regulations. All law enforcement agencies have been fully briefed and instructed to enforce the law within the appropriate limits. The processes for accessing and procuring vaccines for Nigerians has advanced, and we continue to ensure that it will be safe and effective for Nigerians when eventually we procure those vaccines. As you are aware, the whole world is pursuing the same commodity, and we have to secure our source while at the same time preparing our infrastructure and capacity for administration. The Executive Director, National Primary Healthcare Development Agency, would update you accordingly. Closely associated with this, the Presidential Task Force met with the leadership of the Christian Association of Nigeria on sensitization preparatory to vaccine rollout today, 1st February, 2021. The meeting was robust and positive. You will recall that the PTF had previously met with the National Council of Traditional Rulers, the Supreme Council for Islamic Affairs, and the National Traditional Leaders Committee on Primary Healthcare Delivery. We shall intensify close consultation with major stakeholders and other faith-based organizations to increase awareness among Nigerians so that we can reduce the issues relating to vaccine hesitancy. At the last briefing, we informed you that the President has authorized the extension of all measures in place, including the limitation of the categories of workers allowed to come to the office to those above grade level 12. The PTF has received reports from ministries, departments, and agencies who are compelling their workers in categories barred from office to report to work. For the avoidance of doubt, all employees, I repeat again, all employees and the head of civil service of the Federation has already issued a circular to this effect. From grade level 12 and below shall continue to work from home, and no MDA is allowed to vary these instructions. Permanent secretaries and CEOs are to ensure strict compliance. Last week, we received 2 batches of 860 Nigerian deportees from Saudi Arabia. They were received in Abuja by our multi-sectoral teams and have all commenced the post-arrival quarantine phase, during which they will be tested before they are processed further. The Presidential Task Force has reviewed reports received on the new testing regime allegedly imposed by some airlines and associated charges. This is considered inimical to the interests of Nigerians and will be addressed through appropriate channels. The Honorable Minister of Aviation will brief you on the current situation during this season. In our effort to continue to balance lives and livelihood, I wish to state that the PTF is fully conscious of the pains and concerns of the businesses in the aviation and related sectors, especially around international airports that are yet to reopen, Kano, Port Harcourt, and Enugu. We feel your pains and share your fears about the crumbling nature of business environment around these cities. The evaluation of COVID-19 developments is progressing, and we are also expediting action on arrivals of vaccines so that we should further relax the restriction and reopen our vital facilities. Before I invite the Honorable Minister of Health, the DG, NCDC, and the National Incident Manager to update you, I wish to remind all Nigerians that enforcement of the new regulation will be taken seriously and urge full compliance. In the final analysis, let us remember that it is for the good of the individual and his or her loved ones that these measures are complied with. I also urge the media to please go the extra mile to educate Nigerians and report level of compliance. I now invite the Honorable Minister of Health, thereafter the DG, NCDC, and the National Incident Manager to brief you on current developments. And I thank you for listening. Have a very pleasant evening. Thank you.
Honorable Ministers here present, Permanent Secretaries, Director General, and ladies and gentlemen of the press. If anyone had predicted where we would be from this time last year to now, nobody will have believed. The arrival of the coronavirus in Nigeria on the 27th of this same month last year has thrown this country into many, many changes, as it has done for the rest of the world. And where we are today is that as of yesterday, the 31st, which marked the end of the first month of the year, and the entry into the anniversary of the entry of COVID-19 into the country. 685 confirmed cases were recorded, with 8 fatalities, bringing the total number of cases we have had to 131,242 from 1,302,410 samples tested. 104,989 persons have been treated and discharged, while we have sadly lost 1,586 persons, giving a cumulative fatality rate of 1.2%. Testing has been ramped up all over the country except Kogi, such that the month of January saw more than 300,000 tests, representing 25% of tests since the pandemic began. NCDC is coping very well with this upsurge, which is the result of new engagement for increased surveillance and testing. With that, and the higher index of suspicion of our health workers, 43,732 new cases were identified in January, accounting also for more than a third of all cases in the first confirmed case in Nigeria in February, and quite clearly demonstrating the second wave. Sadly, 297 fatalities were recorded this month, last month of January alone. The apparent improvement in case fatality ratio down to 1.2% cumulatively is offset by the sheer number of casualties occurring, which is a typical hallmark of the COVID-19. But it's also a testimony to the fact that earlier detection and more experience with case management leads to better outcomes. Now, it is made possible by the commitment of our health workers at various levels and of the rapid response teams everywhere. I again use this opportunity to, on behalf of our people and the Ministry of Health, express appreciation to health workers for their outstanding national service. Government will continue to provide you support with training, PPEs, and all that facilitate your work and reduce infection risk. We have been keeping a strict eye on vaccine scene, and those who follow international news will have heard of the scramble for vaccines, which has in fact pitched some countries in Europe against each other, as wealthy, high-income countries have paid to allocate vaccines to themselves. A spokesman of the World Health Organization over the weekend estimated that 95% of all vaccines manufactured globally so far have gone to 10 wealthy, powerful countries. We joined the WHO in calling for global equity in the allocation of vaccines, since COVID-19 is a threat to mankind and not just to one country alone. Besides, the Director General of the World Health Organization has repeatedly stated that no country is safe until all countries are safe. The date of first arrival of vaccines in Nigeria has been changing because of the dynamics around the production, movement, allocation, and commitments around vaccine. The decision will lie more with the manufacturer, who all have heavy commitments already and can't meet all their commitments as and when due. According to latest information I have, we have been advised to expect our first vaccines from COVAX facility as from February, as from this month. We shall continue to review plans to ensure smooth rollout in our country, which is a huge task in the hands of the National Primary Healthcare Development Agency, who is better placed than any other organization in Nigeria with the institutional memory from polio eradication and routine immunization to deliver the vaccine to all parts of Nigeria in a very smooth manner. The executive director will elaborate further on the intricate and detailed technical plan that they are making to reach the last mile and the adaptation of all their knowledge so far from vaccinating children to vaccinating adults. As with past immunization activities, the full cooperation of state governments will be critical with regard to supporting remuneration of vaccinators and smooth running of the operation. NAFDAC approval will be required for all vaccines in use in Nigeria, and that approval must be sought and obtained before any vaccine is used. As of now, 2 dossiers for 2 vaccines have been submitted, one from India and one from Russia, which the NAFDAC is already studying. We have said that we have a 3-pronged approach of the health sector, which we have now increased to 4 prongs with the strategy. And the 4 prongs begin with the strategy of community engagement and social mobilization. It is in that regard that we have had the honor of addressing Northern Traditional Rulers Committee last week, and this afternoon the Christian Association of Nigeria, both of which activities were organized by the Executive Director of MPACDA, who will give more details on this engagement, which we think is critical for getting the information and compliance across the field to all the citizens of our country. And I want to thank the Royal Highnesses, the Lord Bishops, our religious and spiritual leaders for their pledge of support and for speaking out clearly in support of government strategy to deal with COVID-19 from infection prevention and control to vaccine use. The second prong is the management of infected persons, starting from the home-based care for persons without symptoms or with non-life-threatening symptoms to those who need admission for severe symptom manifestation. They are all provided with guidelines for their own treatment. We encourage high-risk individuals who have tested positive to report for clinical assessment so that your risk can be told to you immediately. The Ministry of Health's oxygen strategy has been boosted by the addition of the 38 proposed oxygen plants, which are now approaching procurement phase, which are a procurement process, and they will also address the COVID-19 treatment center needs across the country. And in addition, the long-neglected oxygen needs of the health sector now and in the post-COVID era. Global Fund, as I've been talking to them even last weekend, they're on standby to help assess the existing non-functional oxygen plants to see how they can support in repair and reactivation across the country, which is important for the short term. I want to urge patients to comply wholly with their clinicians and trust their clinicians, and for clinicians to also show compassion to patients. The third prong, as I said, is the vaccination exercise, which I've already touched on. Nigeria has been allocated over 41 million doses of the African Union's AVAT vaccines. We are hopeful that we can expect 15 out of the 42 billion doses from COVAX. Altogether, if we get all of this, we can get a coverage for 50% of our eligible targeted for 2021 if we do not get a disappointment, and if all doses are delivered as promised. The Ministry of Health and its agencies will be engaging various segments of society in coming weeks to sensitize them on the continuation of infection prevention and control, and also on the vaccine strategy. The fourth prong is very important, is the maintenance of routine services. We must not make the mistake of allowing too much focus on COVID-19 or too much fear of COVID-19 to allow routine services to drop, especially perinatal maternal health, and especially also non-communicable diseases that are there in the background all the time. However, I must hasten to state here that even with vaccines ongoing, the public health measures which we have been talking about, which include appropriate wearing of face masks, especially in public places, the physical distancing, the respiratory hygiene and regular hand washing, the use of alcohol-based hand sanitizers will continue to be retained and will remain the best measure for controlling this disease. The newly signed act of the President emphasized exactly these measures, and they have become necessary because they still form the foundation of our strategy to address COVID-19 challenge. So therefore, I again appeal to all of us, all Nigerians, to take responsibility and to observe all these measures. It could save your life or that of a loved one. As we work to continue to control the spread of COVID-19, we must continue to remember those who have been victims of COVID-19 and pray that with all our efforts, we are able to get control of this disease in a way that it does not overwhelm our system. Thank you for your attention.
The Chair of the Presidential Task Force and Secretary to the Government of the Federation, Honorable Ministers, DGs of FAN, NCAA, ED, MPHCDA, WR, colleagues on the Presidential Task Force, gentlemen of the press, thank you for joining us again this week. Last week, like you would have seen from our data, we're again experiencing an increase in the number of deaths. So these are really tragic circumstances, and I'd really like to address them today because everything we're doing in the response is really about preventing severe cases and deaths. You know, the number of cases are important, but the most important thing really is the number of very severe cases and deaths, and that's really what we're most worried about. So over the last week, we started the use of rapid diagnostic test kits in 5 hospitals in Abuja. one of the target populations for that are hospitals, to use them both for healthcare workers in routine testing within hospitals, but also for patients that have not necessarily come because they are suspected to have COVID, but have come for other quote-unquote routine medical procedures such as surgeries, so that we're confident in managing them. So it's gone very well for the last week. This week will continue. Our intention is continue to do this across the country, make sure that every federal hospital in Nigeria has access to these RDTs. But eventually, obviously, we don't want to end at federal hospitals. So we really want every hospital, government, private, to really look at using RDTs to improve the safety of the care they provide for their patients, and also provide a safe environment for their healthcare workers by offering them routine testing using rapid diagnostic test kits. So today I really want to call on any state government, any major hospital that wants some advice on what RDT, how, when to use it, to get in touch with us at rdt@ncdc.gov.ng. We've opened up a special service to support you in doing this, advise you on what RDTs you need, what setup you need to set this up, how you should do this, what PPEs you need, how to collect the data, how to transmit the data. So everything about how to set up a successful rapid diagnostic test service in your hospital. We're happy to support you on this. We already have guidance on our website, ncdc.gov.ng, but in addition to that, we're happy to provide you the support in doing this. Why is this so important? We really need to protect our healthcare workers and increase the index of suspicion for COVID among our healthcare workers. In the last 1 week, we had 75 healthcare workers infected in Nigeria. So we're very worried about this. We can reduce this risk. For healthcare workers, we need us all of us healthcare workers, to maintain a high level of suspicion for COVID all the time. So we're hoping that by rolling out the use of RDTs, more health facilities will have access to this over the next month, and this will really become a major tool in protecting ourselves, understanding the infection among ourselves, and understanding what we'll need to do. Of course, that's in addition to everything we've been talking about, the use of personal protective equipment and all other IPC tools, knowledge and expertise that we've developed over the last year. We remain, of course, deeply grateful for the extraordinary work done by doctors, nurses, lab scientists, pharmacists, all healthcare cadre across the country over the last year. But again, I really want to also address doctors and nurses more specifically around the index of suspicion around COVID for your own patients. So over the last weeks, we've had several reports of patients who have been managed for days over a series of rounds of malaria treatment and other sorts of treatment without anyone thinking about COVID. I mean, it's almost impossible to believe, but this is really what is going on. So, colleagues, we need to significantly raise our alert levels to this disease. COVID has to be ruled out. When patients come with vague symptoms of body aches, a little bit of fever, a little bit of weakness, persisting for weeks, please, we can't continue treating them on series of malaria treatments and antibiotics and whatever else we're doing. So this is really a call to action. We are working very hard to enable better access to diagnostics. We need you, our doctors, to use this and use it to enable us make this diagnosis to provide treatment for our patients and for yourselves. The second point is we also need our healthcare workers to really model the behavior that we're talking about. We visited some health hospitals over the last week in the course of rolling out our RDTs. And we noticed many doctors, nurses, pharmacists themselves not using masks within a hospital premises. So we don't want this. We need to not only talk the talk, we need to walk the walk. So this is really calling on all colleagues across the country to model the behavior that we preach, so we can have at least a chance to convince others that this is really the right thing to do. My third point really is to Nigerians. There's an increasing emergence of stigma around COVID. And this weekend I heard something most surprising, that some people are avoiding testing in case they are told that they're positive. So, it defeats everything we're doing if the perception of a test leads to some level of stigma that then discourages people from going to tests. So what then do we do with this entire response? So, gentlemen, this is a virus. There's nothing to be stigmatized about it. The same as you want to go for a test for malaria or typhoid, it's the same. We're encouraging you to go for a COVID test if necessary. It is through that we can enable you access to care. Everything we've now learned shows that the early administration of treatment, especially if you're symptomatic, leads to better outcomes. But we cannot even start you on that journey if there's not enough courage to at least do a test. So really, this is really encouraging everyone. If you're feeling unwell, please avoid self-medication, get tested to rule COVID out, isolate while you're waiting for the results. And if you then test positive, please notify others that you may have been in contact with over the last few days. Don't be afraid. Do tell them. You might be saving their lives by telling them. This enables them to then take the necessary action to protect themselves, protect their families, and prevent transmission. If you have notified someone you came in contact with, please be responsible and encourage them to get tested while waiting for the results. So finally, just a quick update on the variants of concern circulating. We are all aware that there's increasing transmission, and this virus is adapting really all the time. We're working very hard with my colleagues to get access to the vaccines, because if we don't, the virus just keeps circulating and mutating and potentially getting better adapted to the environment and ability to transmit. So an additional layer in understanding this is improving our capacity for genomic surveillance. And we're continuing to do this. Over the last week, we've been working with a few other centers in the country to define an approach to improving our ability on genomic surveillance. So on the 30th of January, our partners at the Africa Center for Excellence in Genomics in Ede confirmed 6 more cases of the UK variant in Nigeria, and 1 in the FCT, the old one, 5 Osun, and 1 from Kwara State. So altogether, we now have 7. Now, the number in Osun State obviously relates to the fact that this center is in Osun State, so it should not be overinterpreted. And the fact that we're finding this variant is not surprising. It's been found in more than 50 countries around the world. So as countries look for this, they will find them, because people travel, and viruses travel with people as they travel. However, what we now have to do is set up a process for genomic surveillance, collecting a certain number of viruses, sequencing them at specific intervals to understand what is happening in our own context. And that is really the focus of a lot of activity right now. But just to conclude on that, whether it's this variant or the other variant, the response from us is the same. We need to continue doing the things we need to do, avoid gatherings, wash our hands regularly, wear a face mask, and ensure that we are physically distanced from each other as much as we possibly can. So to conclude, this is the beginning of a new month. All of you would have gotten the Happy New Month WhatsApp messages that I sent all over. I got quite a handful myself. But let's remember, we need to really continue working very hard through this phase of the pandemic. Please continue to avoid large gatherings, wear a mask, wash your hands frequently. Do all of these in combination whenever you can. As we prepare to celebrate Valentine's Day, I know it's on the mind of many of us, please, it's not enough reason to lay down our guards, like the DG of WHO said over the weekend. And please do listen carefully. Please treat the decisions about where you go, about who you meet, as life and death decisions. It may not be your life, but the decisions you take could be the difference between life and death for someone you love or a complete stranger. Thank you very much.
Secretary to the Government of the Federation and Chairman, Presidential Task Force, Honorable Ministers here present, Director Generals, Permanent Secretaries of the Press. Mr. President has signed the Public Health Protection Regulation last week. And this is an important milestone in our fight against COVID-19, because it provides the enabling legal framework for the government and other security agencies to be able to enforce this regulation. This enforcement is necessary because unless we are able to contain the epidemic, unless we are able to make people to comply to this regulation, the epidemic will continue to propagate. Currently, the PTF is working to provide support to various states through their task forces towards contextualizing and implementing this regulation. As mentioned earlier, the regulation covers places of worship, public transport, banks, workplaces, schools, and so on and so forth. Notable features of the regulation include restriction of gatherings, mandatory wearing of face masks in public, and above all, the powers of prosecution by law enforcement agencies. We expect governments, institutions, owners of private buildings, and other regulators to enforce these regulations by, for example, putting a notice of no mask, no entry, or no mask, no service to enlighten the users of your services. Practical strategies will be adopted that will include mobile courts in strategic locations such as markets, motor parks, and it is expected that every organization will monitor compliance of staff or the space within which they supervise. We are providing advisory to the states to develop and implement community engagement strategy and risk communication strategies to sensitize the public on compliance to these regulations and to promote behavioral changes. Last week, we started with the FCT, where we had a very fruitful meeting with the FCT minister and the stakeholders of the FCT. We are currently developing the implementation plan and the timeline for which the FCT task force will commence operation all over the Federal Capital Territory. Related to this, the PTF has analyzed the epidemic in the country, and we have identified 22 high-burden local government areas located within 13 states. These areas, these local government areas, which are mostly the cities or the state capitals, contribute over 95% of the epidemic, particularly new cases in the country. The states include Nasarawa, which has both Lafia and Kefi, Plateau, Jos North and Jos South, Rivers, which is Port Harcourt, Katsina, Sokoto, Kaduna, both Kaduna North, Kaduna South, and Chikun LGA, about 5 local governments in Lagos, FCT, Amak, and Gwagwalada, Enugu, Gombe State, Kano, Katsina, and Ilorin South and Ilorin North. These LGS, as I mentioned, contribute over 95% of the new cases that have been recorded in the last 6 weeks. In addition to this, we have states where data is not coming forth. If we don't test, your data will not be analyzed. If your data is not analyzed, we won't know the level of the epidemic in your state. Notable among the states that have not been reporting adequately include Yobe, Jigawa, Zamfara, and Kebbi State. And of course, Kogi State that has not been reporting at all. States that are not testing are probably at much more higher risk than the states that currently we know as high burden states. A state that is not testing at all is an absolute high risk for Nigerians to go there because there is no testing facility, even if you fall sick, and there is no isolation facility, and they don't even acknowledge that the disease exists. So for that reason, epidemiologically, we put that state at the top of high-risk states. The PTF will soon be communicating the list of 100 defaulters this week. As you are aware, all travelers are expected to test within 7 days of arrival through the International Travel Portal. We have published the list of the first 100 in the first week of November, by November 3rd, in our national papers. The next batch of 100 will now be published this week. These are people who arrived in Nigeria who either refuse to pay for testing or undertake the testing, or have not shown up at all in any laboratory to determine their status, or did not even do the quarantine. So this list will now be published. While enforcing these sanctions, it's paramount that I appeal to everyone coming into the country to adhere to these protocols for public good and safety. It's only with strict adherence to testing, containment, and non-pharmaceutical measures that we will be able to control this epidemic. While we are talking about COVID-19 pandemic, we also have to talk about the second pandemic. The second pandemic is perhaps more deadly than COVID-19, which is fake news. There is no doubt that many people continue to propagate and disseminate fake news and information from unverified sources. And this is not limited to Nigeria. We are aware it is global. And this ranges from conspiracy theories about the epidemic itself or the virus itself, or about the treatment, including vaccination. We urge people to continue to obtain information from health professionals, people who are vested with the knowledge, and people who are credible in terms of providing reliable scientific information. The PTF website, the NCDC website, continue to provide advisories and protocols to guide you on accessing testing, treatment, and care. For more information on progress to secure safe vaccination, you can also visit the website of Federal Ministry of Health or National Primary Healthcare Development Agency. Thank you.
Gentlemen of the press, good evening. From the brief from Aviation for today, some countries, a couple of countries, namely UAE and Netherlands, have put in extra requirements for passengers going into their countries. Some are specific to Nigeria. In addition to the agreed requirement for PCR test before you depart from Nigeria to that country, they are now also adding an extra requirement of having a rapid test done 4 hours before departure, before you board. So you do the PCR test within 72 hours, and 4 hours before departure, you do the rapid test. The PTF recognizes the right of all countries to put in measures to protect their citizens, just like Nigeria has done. However, these countries or these airlines cannot determine for Nigeria whom to approve or how this test can be done. We are going to be having a discussion with these airlines and these countries. If they insist on having this additional test being done, then PTF has decided their operations will be suspended into Nigeria until the time the PTF puts in a structure and deals with the logistics and how the second test can be done successfully within 4 hours of departure to these 2 countries. And I'm sure other countries will probably come up with something close to that. And the importance of this is for the PTF to have a clear, transparent, open process on determining who will do this test. That's a requirement for accreditation by NCDC and also approval by the National Laboratory Councils and Lagos State Government for Lagos Airport and FCT for Abuja. Initially, the PTF has started the procurement process of whom will be allowed to do this test in the airport, and there was a short list of, I think, 4 or 5 companies. So this process will be brought to conclusion in order to select these laboratories that will be carrying out the tests at both Murtala Mohammed Airport, Lagos, and Nnamdi Azikiwe International Airport in Abuja. So another brief from the aviation, the Nigerian Civil Aviation Authority, NCA, has started implementation of sanctions against airlines that have brought passengers that are not in compliance with our COVID-19 protocol into Nigeria. Some of the airlines have been fined, a couple have paid, and others have requested for further information for them to process this. So we are working closely with the Port Health authorities to have an updated list of those who are in non-compliance with the PTF protocols into Nigeria. For now, that's the brief from the aviation sector. Thank you.
To discuss with you once again, gentlemen of the press, our collective efforts to stop community transmission of COVID-19. I am glad to inform you that preparations are underway for the COVID-19 vaccine introduction. The COVID-19 Technical Working Group, which constitutes experts from the Presidential Task Force, the Federal Ministry of Health, Nigeria Governors Forum, our NPHCDA staff and development partners have been working daily to monitor the level of preparedness towards the successful rollout of COVID-19 vaccines and subsequent implementation in Nigeria. In spite of the challenges caused by the delay in the arrival of the vaccines and the difficult task of accessing the COVID-19 vaccines, we are optimistic that the experiences and manpower acquired from eradicating polio and Ebola will help us in the effective implementation of the COVID-19 vaccination program when the vaccines become available. The federal government of Nigeria is engaging in several discussions, including with the African Union Commission to access COVID-19. The African Union Commission, through the African Vaccine Acquisition Task Team, has approved approximately 41 million doses of a combination of the Pfizer, AstraZeneca, and the Johnson & Johnson COVID-19 vaccines to be delivered between March and April 2021. Furthermore, the COVAX facility has informed us that they will be supplying Nigeria with approximately 16 million doses of the AstraZeneca vaccine this month. This will replace the earlier communicated 100,000 doses of Pfizer mRNA vaccines, which we all agreed was grossly inadequate. It is pertinent to note that the expenses incurred by the federal government in the process of procurement and administration of COVID-19 vaccine is in fact an investment towards strengthening the primary healthcare system in Nigeria. This is because in the short and long term, it will afford the nation a more capable health workforce with globally standardized infrastructural improvement that will not only serve in this fight against COVID-19 disease, but also place the country in a better position to seamlessly undertake routine health services and manage any potential future pandemics. This is in line with the recent observation and recommendations made by our donors and development partners. As we continue our media appearances and stakeholder engagements to provide the facts and reliable information about COVID-19 vaccine and the planned vaccination process, credible and respected Nigerians ranging from the academia to religious and traditional leaders have been lending their voices to support government's plan on the COVID-19 vaccine introduction. In the past week, we have started with the Medical Women's Association of Nigeria and the Muslim Scholars of Nigeria under the umbrella of the Supreme Council on Islamic Affairs. Earlier today, as earlier mentioned by the chairman of the PTF, we met with the Christian Association of Nigeria. We also had the 2021 first quarter meeting with the Northern Traditional Leaders Committee on Primary Healthcare Delivery with the theme COVID-19 vaccination. The meeting was presided over by His Eminence, the Sultan of Sokoto, who gave the assurance that the religious and traditional leaders will continue to support government's efforts to fight the COVID-19 pandemic. He further urged people to desist from circulating rumors and misconceptions, but rather to be open-minded to gain accurate knowledge about the vaccine. The traditional leaders' influence on the society cannot be overemphasized. Therefore, his assertions were confident that it will help in the mobilization of community members and impact positively in rebuilding the trust of Nigerians to accept COVID-19 vaccines. Another engagement was through a webinar organized by the Sir Ahmadu Bello Memorial Foundation. We drew a team of medical experts from far and near, governors, traditional leaders, and religious leaders to sensitize the public on the safety and efficacy of COVID-19 vaccines. So far, all the COVID-19 vaccines currently available and administered in different parts of the world have been shown to be highly effective at preventing the disease. The information out there that the COVID-19 vaccine contains harmful elements that alters the DNA is patently false. COVID-19 mRNA vaccines do not interact with our DNA in any way. mRNA never enters the nucleus of the cell, which is where our DNA, that is the genetic material, is located. vaccination remains the safest and most effective public health intervention known to man. Throughout history, vaccines have saved millions of lives. According to Gavi, the Vaccine Alliance, a comprehensive study reveals that over the past 20 years, 37 million deaths were prevented by vaccine programs in low and middle income countries. The preventive quality of vaccines has socio-economic value, as treating the disease burden costs a lot higher than vaccinating against the disease. In the case of COVID-19, we have seen the ravaging effects of the pandemic on small and large-scale businesses and our economies in general. Based on what we know about vaccines for other diseases, experts believe that getting a COVID-19 vaccine will protect you from getting sick from the virus, and even if you do get COVID-19, it will prevent you from getting seriously ill and subsequently prevent the need for hospitalization and death. The COVID-19 vaccine, therefore, provides hope for an effective way of curbing the spread of the disease, and the sooner we're able to protect our communities to return life to normalcy, the better it is for all of us. I want to end by re-emphasizing that the federal government, under the leadership of His Excellency, President Muhammadu Buhari, through the Presidential Task Force on COVID-19, is determined to take all necessary steps to overcome the vaccine supply challenges the country is experiencing and ensure an efficient rollout of COVID-19 vaccination in Nigeria. In the meantime, Nigerians are advised to continue to take responsibility for themselves and their loved ones and adhere to the protocols of infection prevention and control through wearing of face masks, hand hygiene, and physical distancing. Thank you very much for your attention.
I want to thank you.